Welcome to The Explainer. Today, we are unraveling a medical mystery that sounds, honestly, almost impossible. We're looking at the case of CJ, a 46-year-old man who didn't brush his teeth for 40 days. Now, sure, it sounds like just a bad hygiene habit, right? But this single omission triggered a catastrophic chain reaction in his body, ultimately landing him in the emergency room with failing kidneys, plummeting blood pressure, and finally, a deep coma. So how exactly do those dots connect? Okay, let's dive into this. To solve this incredible medical detective story, we can't just look at the biology in a vacuum. We first have to understand the deeply tragic human elements that set the stage for this kind of physical collapse. A body doesn't just shut down overnight, It's often pushed to the absolute brink by circumstances we can scarcely imagine. Section 1. A tragic chain of events. Because before we even get to the emergency room, we need to understand exactly how we got there. This isn't just a clinical case study. It's really a heartbreaking story of compounding loss. Let's go back 5 years. On his 41st birthday, CJ's 5-year-old son tragically died in a freak accident. And when he returned from bereavement leave, he was laid off. His wife left shortly after. Completely bankrupt, he moved into government housing, where he found his only comfort in cheap, sugary foods, eventually gaining over 250 pounds. But the final blow came just 2 months ago, when his mother passed away. In his profound sadness, severe depression just took over completely. He stayed in bed all day. He completely abandoned his personal hygiene. He stopped bathing, and crucially for our story, he stopped brushing his teeth. So when CJ finally sought help after losing 15 pounds in just 2 weeks, the physical clues were deeply alarming. He was experiencing what doctors call polydipsia, basically an absolutely unquenchable thirst. And to quench it, he was drinking 2 entire gallons of juice every single day. His reasoning was tragic, but honestly, understandable. Juice comes from fruit, so he figured it had to be healthy. This naturally led to polyuria, meaning he was urinating every 15 minutes. Outwardly, his face was swollen, turgid, and bloated, and inside his mouth, a severely infected tooth with multiple pustules along his inflamed gums, all because he hadn't picked up a toothbrush in 40 days. Moving on to section 2, clues in the blood. Let's look at the lab results to see what actually caused his blood pressure to plummet and force him into a sudden coma right there in the ER waiting room. When the doctors tested CJ's blood, they found a staggering number. His blood glucose level was 800 milligrams per deciliter. To put that into perspective, that is literally more than 10 times what you would see in a normal, healthy person. CJ was in a full-blown hyperglycemic crisis. And this brilliantly illustrates the sheer scale of the problem. Because CJ weighed over 400 pounds at admission, he had about 9 liters of blood in his body. At his specific glucose concentration, that means there were 72 grams of sugar, almost 1/5 of a pound, just floating freely in his veins. A normal 175-pound adult only has about 4 grams. But here is the massive medical mystery. CJ drank 2 gallons of juice, which contains roughly 850 grams of sugar. If only 72 grams are in his blood, where on earth did the remaining 700 plus grams go? Well, to answer that, we have to look at some basic human physiology. Normally, as your body digests food, sugar absorbs through the liver right into your bloodstream. This triggers the release of insulin, which acts as the key that unlocks your cells to safely store that sugar as energy in your muscle, liver, and fat tissue. But over the last 4 years, CJ's diet of sugary and fatty foods, combined with his class 3 obesity, constantly flooded his system with glucose. His body was churning out an absolute overabundance of insulin. Eventually, his cells basically threw their hands up and said, "We're full." They downregulated, meaning they literally decreased their insulin receptors. They became insulin resistant. Because the cells rejected the sugar, his body converted what it could to fat, but the rest was left to dangerously accumulate in the blood, eventually overloading his kidneys and spilling right into his urine. This was a long-term chronic failure of his system. Which brings us to section 3, the osmotic effect. We have to shift from his chronic dietary issues to the acute, life-threatening chemical consequence of this sugar overload. You see, CJ was suffering from a hyperosmolar hyperglycemic state. Hyperosmolar sounds like a mouthful, but it just describes the terrifying chemistry at play here. Glucose creates an osmotic gradient. A simple way to understand this is an experiment from our source material. Imagine a pool filled with sugar water. If you submerge a tube of fresh, distilled water into that pool, the fresh water gets rapidly pulled out of the tube and into the sugar pool. Bottom line, wherever sugar is, water will aggressively flow towards it. And this sets off a catastrophic domino effect inside his body. First, that massive amount of sugar in his blood acts like a giant sponge, drawing water right out of his cells. His shrinking cells panic and tell his brain, hey, we are dehydrated. This triggers his unquenchable thirst. So he drinks more juice, adding even more sugar. The water floods his intravascular space, forcing his kidneys into absolute overdrive to filter it out, hence the constant urination. But it doesn't stop there. The sugar actually begins to draw water directly out of his brain, dehydrating his neurological tissue, which is exactly what caused his sudden coma. All of this massive fluid loss dehydrates his whole body, decreasing blood flow to his overworked kidneys, and ultimately causing an acute kidney injury. With his kidneys shutting down, the horror truly begins. Waste products that should have been safely flushed down the toilet as urine were now trapped, floating around in his bloodstream. This massive imbalance of calcium and phosphate literally began rotting his bones. Excess nitrogen altered his brain chemistry even further, and spiking potassium levels threatened to disrupt the electrical signals of his heart. So, the hyperosmolar state perfectly explains the coma and the failing organs. But wait a second. We are missing a massive piece of the puzzle here. CJ's diet had been terrible for 4 years. Why did his body suddenly cross the point of no return exactly 2 weeks ago? To figure that out, we have to go back to that single unbrushed tooth. Let's hit section 4, the tooth connection. This is the real climax of our medical mystery. It all comes down to the direct mechanical path from an ignored personal hygiene habit to a lethal metabolic disaster. After 40 days without a toothbrush, a simple infection in his mouth grew into a highly painful abscess. That localized infection broke through his gum tissues and seeped directly into his systemic circulation, spreading throughout his entire body. This is called septicemia, literally bacteria in the blood. CJ's immune system detected this massive threat and activated a severe physiologic stress response, releasing a massive, sudden surge of adrenaline. Now, normally, a huge adrenaline dump is a great survival mechanism, right? If you're scared or excited, your body forces your liver and muscles to dump stored sugar into your blood to give you the energy to fight or flee. But for CJ, this response misfired catastrophically. The adrenaline forced his liver to dump even more sugar into a bloodstream that was already hyper-sugary and incredibly toxic. This acute physical stress from a toothache amplified the 2 gallons of juice he was drinking, completely pushing his blood sugar past the tipping point, locking him into a hyperosmolar crisis that he just couldn't escape. Section 5, treatment and recovery. Because without intervention, this underlying metabolic derangement would have quickly led to a fatal cardiac arrhythmia, sudden death. But thankfully, CJ was in an emergency room. CJ's ultimate diagnosis was type 2 diabetes. As a quick refresher, this is a disorder where the body creates insulin, but the cells no longer respond to it. Interestingly, this phenomenon actually isn't new at all. In 1500 BC, ancient Egyptian physicians documented a disease of too great emptying of the urine that attracted ants simply because of the high sugar content. Ancient Chinese medical texts also describe this exact same thing as sugar urine disease. But luckily, unlike ancient times, today we've got incredible intensive care unit protocols. The doctors first attacked the root trigger. They gave CJ antibiotics and extracted the abscess tooth, which shut off that adrenaline stress response. Then they had to fix the hypertonicity of his blood. Over 48 hours, they infused him with up to 20 liters of intravenous water. 20 liters. This diluted the thick, sugary plasma, delivering oxygen back to the dried out kidneys so they could filter waste again. Finally, they administered intravenous insulin to basically force those stubborn cells to accept sugar and water once more, all while carefully replacing the potassium you lost during his massive urination. CJ survived, but literally only because he lives in the modern era. I mean, think about it. Back in the early 1900s, a diabetes diagnosis was an absolute death sentence. It wasn't until 1921 that Canadian physician Frederick Banting first extracted insulin from cows, finally making diabetes a treatable illness. It actually took until 1957 for science to fully understand the pathogenesis of the hyperosmolar coma CJ suffered. And it was only in 1980 that genetically engineered E. coli allowed us to produce pure human insulin, preventing the allergic reactions that used to plague patients taking animal-derived doses. Thanks to these incredible medical advancements, along with counseling and social support, CJ did make a full recovery. He pulled back from the absolute brink of death. But his story serves as a profound warning for all of us. As we age, our metabolisms inevitably slow down. We lose total body water, we lose skeletal muscle mass. If a single unbrushed tooth can create enough physiological stress to tip the scales of a struggling metabolism into a deadly coma, we really have to ask ourselves, what small, seemingly insignificant daily health habits are we ignoring right now? Because our bodies are incredibly interconnected, and sometimes the smallest neglected detail can break the entire machine. Thank you so much for joining me on this explainer. Take care of yourself and be well.